Good morning, everyone. I am a little stuffy today. I apologize for my voice. I don't have the greatest voice anyway, but this is week one pharmacology. I am updating this from some voiceovers I had originally done when I first learned how to do voiceovers. And I hope it'll be helpful to you. We do have a lot of holidays that come during the spring term for the Monday classes, so hopefully this will help you get a good solid start on what you need to know out of your introductory chapters. So sometimes the students, and I've seen this in multiple situations, you do these online modules that go along with your learning and you forget the basics in the basic first chapter. So please take a really good look and think about some of these topics. Pharmacology is the study of drugs or medications. It has to include your understanding of how drugs are administered, where they travel in your body, what kind of responses they produce, and something I probably should have added here, what kind of teaching does a patient need about the drugs that they're taking. So medications in the United States are approved by the Food and Drug Administration, the FDA. Any laboratory has to solicit approval from them before they market a drug. There is a place called the Center for Drug Evaluation and Research, is a division of the FDA. They determine the safety and efficacy of any drug before they put it on the market. There's a new vocabulary word there for you. Efficacy is the ability to produce the desired or intended result. So here's another term for you is prototype. So this is one drug from a class of drugs that's well understood. So something you need to understand, we can't learn every drug in a drug book. We're going to learn classes. So what a prototype is, it serves as a model for the other drugs in that class. So here's the example I'm going to use with you. Aspirin is a prototype non-steroid anti-inflammatory drug. They call it an NSAID. It's one of our first drugs we're going to learn here in weeks 1 and 2. And there's some other NSAIDs, ibuprofen, naproxen, diclofenac, and those medications all are in that same class, and they all have similar side effects. So you have to kind of learn them in a group, and it helps you to learn them better if you learn them that way. So there's three description topics on here. The first one is chemical name. That is describes physical and chemical properties of a particular drug. A generic name describes the active ingredient of the drug. It's usually written in lowercase letters, and there's usually a trade name that's capitalized. Example, if the medication has an active ingredient, ibuprofen, that would be the generic name, but there is a company that markets it under the name Advil, which is capitalized. I actually don't know the chemical name of that, and I don't know that most nurses do. Sometimes you do end up finding out the chemical name. If it becomes important on a drug card or something, we can talk about that. Teratogen is an agent that disturbs the development of an embryo or fetus. Any type of drug like this halts the pregnancy or can produce a congenital malformation. They actually classify these radiation, infection, chemical, or being related to drug ingestion. It is the nurse's responsibility to know the drug classification, any actions, side effects, and the preparation of the drugs that a patient takes. The nurse is in charge of safe administration and evaluation of a patient's response to the medication. They're supposed to watch for drug reactions. They're supposed to alert any personnel of any allergies by documenting on the MAR, which is the medication administration record, and communicate with physicians and pharmacists regarding that allergy. What I get from a lot of nursing students, and maybe you work out at a nursing home particularly, that would be where I note it. They'll go, well, I'm at a nursing home and they just pop them in the cup. And you're probably right. I do see that. If they know the patient well and they know the drug, you may or may not see them and you may not realize that they know the drug classification. I beg you to stop and ask them. Ask them what the drug is. They should be able to tell you. Okay. At least say that's a blood pressure pill. And if it's a blood pressure pill, we worry about people standing up with their blood pressure dropping and then falling. If it's an antibiotic, we worry about allergic reactions. So any nurse that you ask is going to be able to tell you that, even if you don't realize it when you're at your job and you're working. So just kind of keep that in mind. So the word parenteral is an adjective. It means administering a drug elsewhere in the body other than the mouth. Okay, that is versus the word enteral, which would be putting something into your stomach. Okay, so make sure you get your vocabulary down because it seems to hurt students when they don't. First word here, intradermal, used for TB or allergy testing. It's a 26 to 27 gauge needle. You inject it about mid forearm, and you also put on the scapula. On the back area, it's usually at a 10 to 15 degree angle with the bevel up. You will see a small little bleb pop up when you do this. We'll practice these in the lab. The other drug thing here is subcutaneous, used for insulin or heparin. Subcutaneous is fat. Okay, I don't know how else to say it. It's usually a 3/8 inch or 5/8 inch needle, 25 to 27 gauge needle. If it's you pinch the skin up and inject in the abdomen. You can do hips, a lateral or upper arms, or the thighs. Now, they have on here 45 degrees. I've seen people are back and forth over this. If it's somebody really obese, you could probably put a subcutaneous in at 90 degrees, and I would be okay with that. It would depend on the patient. So intramuscular, it's 1 inch to 1.5 inch needle, a 22 to 25 gauge needle. You spread the skin. You can either go ventral, gluteal, deltoid, or vastus lateralis. There is an area back in the gluteus area that is often used still by nurses. They don't recommend it though anymore. This is always at a 90-degree angle. We have drugs that are given intravenously, and then we have drugs that are given by an epidural. So we should talk about the term pharmacokinetics. Pharmacokinetics is sometimes described as what the body does to the drug. It's referring to the movement of the drug into and out of the body. And so it's absorption, its distribution, its metabolism, its excretion, and its bioavailability. So let's look at this a little bit. Absorption is the movement of the drug into the bloodstream. That should make sense to all of you. You take the drug, you absorb it. Distribution is when that drug is moved out into the interstitial and the intracellular fluid. Metabolism, the liver is the primary site of drug metabolism. It plays a major role in metabolism, digestion, detoxification, and elimination of substances from your body. And our last big term here right now is excretion. It's the final elimination of that drug or that compound from your circulation. One of the big sites here is going to be your kidneys. The elimination of the drug or compound is out through the kidneys. It is actually your primary site of excretion. Your other site could be your liver. It goes into your stool, your saliva, or sweat. So this whole drug excretion topic is kind of a big deal. If a drug is excreted through the kidneys, are you having a kidney problem? Renal failure will diminish excretion of any medications, and the drug is retained in your body for an extended time, and you have to reduce the dosage of the drug. Another organ of excretion is your respiratory system. If there's any drug that goes into a gaseous form, it's excreted by the respiratory system. We have to kind of adjust those sometimes too. And obviously, if your liver's not working, anything that's eliminated through your liver through biliary excretion, those drugs sometimes need the doses adjusted to accommodate whatever the health of the individual is. So there's lots of factors affecting drug absorption: the route, the drug dosage, your digestive issues, blood flow to the site of the drug administration, pH of the body, any type of interactions with food or other drugs. And there are a lot of differences in metabolism. The elderly and infants have decreased liver metabolic activity. Patients that have severe liver damage have decreased metabolic activity, and the drug dosage may need to be adjusted. So there's something called plasma half-life, and you need to know what that is. You need to treat it like a new vocabulary word. It's the length of time required for the medication to decrease its concentration in the blood by 1/2 after it is administered. It's describing the duration of action of the drug. The greater the half-life, the longer it takes to be excreted from the body. Some drugs have short half-lives. They need to be given more frequently. Plasma half-life will increase with people with renal or liver disease. We don't want the drugs to become toxic. So an example, the half-life of mercury is 30 years. Okay, that means your mercury stays in your body and it is at half strength after 30 years has passed. The half-life of Prevacid is 2 hours. That means if I take a Prevacid of 50 milligrams right now, in 2 hours, it'll be down to 25 milligrams in my system. Okay, and that's what they're talking about, half-life. And it can be kind of an interesting way to kind of look at when you're learning pharmacology. This one's kind of hard sometimes for students to process. I'm not sure why, but there's a thing called therapeutic index. Basically, they're taking the drug level in the system of the body. Technically, the definition says it's a measure of a drug safety margin. The higher the value, The safer the medication, but let me be more clear with you. I'm going to use the drug vancomycin. So vancomycin can be very toxic to the kidneys when the body goes to excrete it. So you usually give it once a day. And before you give the medication, you're going to check something called the trough level. Now, trough, I actually grew up in Akron, but I live out in Hartford now, and a trough is down in the barns, in some of the local barns. A trough's a little low on the ground feeding uh, station. And so you draw a trough level on a medication immediately before the IV medication is given. You want to see what the low level is in the blood. And then after the medication is given, you draw a peak level at 1 or more hours after you give the IV medication. Okay? And I'm going to go over you with that in lab and kind of make sure that you understand that concept. More vocabulary. Potency. A drug that is more potent will produce a therapeutic effect at a lower dose. Efficacy, we already talked about. The magnitude of the maximal response that can be produced from a drug. It's usually the efficacy is more important than the potency of the drug. And two that you need to remember are agonist. An agonist is a helper, okay? It has a great response. If you take a drug that's an agonist, it is a helper. Albuterol is a beta agonist. It helps you to breathe better if you have asthma. Antagonist is a drug that blocks something. A beta blocker blocks beta. It goes to the receptor and prevents something from happening. We'll go over that in class, I promise. One thing that falls under the role of a licensed nurse is that you have to obtain a drug history. So you have to talk to people. You have to use open-ended questions and closed-ended questions to get information. You need to know if they have a history of a drug allergy, any past medical history, family history. What medications are you currently using? Do you have any personal history of using alcohol, tobacco, or caffeine? Usually they ask reproductive questions if you might be pregnant. They ask if you're taking over-the-counter drugs. Dietary supplements and herbal products now are included in this topic of obtaining a drug history. There's several types of prescriptions you can get when they give you a prescription order. It can be a routine or standing order. A single or one-time prescription, that's when you go into the doctor and maybe they give you antibiotics for some type of sinus infection. A stat order is something that they want given now, and usually it's a one-time dose. PRN is a Latin term, and it means it can be given anytime. An example of that would be may take one acetaminophen every 6 hours, PRN as needed for headache. Would be an example of what the order would look like. These are all the components of a prescription for it to be complete. You need the patient's full name, the date and time of the prescription, the name of the medication, the strength and dosage of the medicine, route, time and frequency of administration, quantity to dispense, and the signature of the provider. So another term you need to add to your vocabulary list is medication reconciliation. So this is when the nurse compiles a list of the patient's current medications with the dosages and frequencies. And the best way to do it is just have them bring their bottles. Half the time they don't know what they even take. And I'm just being honest with you. And this has to include over-the-counter medications along with vitamins and herbs. You would compare what they take at home with what the physician ordered it, and you can do the reconciliation with it to the provider if you need to resolve any discrepancies. This is what you do on admission, or if you transfer between two units or facilities, or when you discharge a patient. So we've always had for like a very, very long time, like the 5 or 6 rights of rights of medication administration, and they're listed. I did the 5. I actually did 5 here, but the 6th one. So the first one's make sure you have the right patient, the right medication, the right dose, the right route of administration, the right time, and the right documentation. Recently, they've added a few more in the textbooks. The ones that were added were right patient education, their right to refuse, the right assessment on them, and the right evaluation. This is something that all nurses know, and I got this thing I do, and I say it's a Sanka thing. And Sanka is actually a really horrible coffee, decaffeinated coffee from the late 60s and early 70s. It came in an orange can or orange packet. It had to be added, hot water was added to it to make it taste terrible. But it was all they had for decaffeinated coffee at the time. But for me, it came up and I said there is certain stuff all nurses know about, and if you put that down, that spells Sanka. And all nurses know know this. I don't care if I get an OB nurse here, instructor, or I get our program director, they're all going to know right patient, right medication, dose, route, time, and documentation. And you need to be able to do that also. And it's just memory, just be able to rattle them off on your hand to anybody who asks. So, what constitutes a medication error? It would be the wrong medication, the incorrect dose, or the incorrect IV rate, wrong patient, wrong route, giving something somebody's allergic to, administering something when we found out that we knew the patient was allergic to, admitting a dose, omission, omit. By the way, omit means to not give. Omission, omit. And people ask me what that meant. If you incorrectly discontinue a medication, if there was inaccurate prescribing, you give a medication that has a similar name but was the wrong drug. If a significant problem in someone's healthcare came up when you gave the medication, those are all considered medication errors. So, what are some good ways to prevent medication errors? Do a good assessment. Be knowledgeable about what you give. Get information to figure out, can they swallow? Are they allergic? Do they have heart, liver, kidney disorders? We need a heart rate and a blood pressure on people that get blood pressure meds. If it's something to do with their blood sugar, we need blood sugar on them. If you need to omit or delay something due to their status, you have the right to do that. Look at the prescriptions, make sure they're complete. If it's not clear, we call the doctor. This isn't rocket science. You can refuse to administer something if it isn't safe. Safety, safety, safety. You question any abrupt change in dosage for a patient's medications. That's how we keep people safe. Some other ways to prevent medication errors. You need people, don't use expired meds. We always return those to pharmacy. You need to avoid distractions during med prep. Okay, this is what I got to say to you. Giving the med is not that hard. My family, bless my wonderful family, if they know how to read a medication label and ask you your name. What happens is you're going to get distracted. Okay, I think this is the big thing. People come up. There's a phone call for you. Family wants to talk to you. The doctor wants to give you an order. It's very distracting and really easy to make a mistake. You want to just prepare meds for one patient at a time. I know you're going to come up and tell me, where I work, I don't care. Okay, don't prepare more than one person at a time for me. Check your labels, measure your doses accurately, double check if it's a high alert medication. That would be like insulin. Make sure and follow your rights of med administration. Don't leave meds at the bedside, and don't tell me you saw it at your job. Do you want me to let my students, when I'm with you guys, if I'm caring for your family member, leave the meds at the bedside? And I'm going to say, you better say not. Don't say, oh yeah, sure, it's fine. Leave the meds at the bedside. No, it's not. You don't leave meds at the bedside. I don't care what you've seen. Don't get into bad habits that are going to not be safe. I know you guys have heard the term electronic health records. The computer switchover happened, I'm going to say probably about 98 on. We started just seeing the switch over to electronic health records. So most people now do the e-prescription. When you go to your doctor, he doesn't give you a paper prescription. He sends over the prescription to the pharmacy through the electronically. And if you get, like I know I do Express Scripts, they send everything there electronically. That's called an e-prescription. They have in the hospital what's called a barcode assisted medication administration, where they scan the barcode on the drug, they scan the barcode on your arm to make sure it's the right person. We normally, though, even though they have that, I tell you to ask the patient's name. I don't know that something hadn't gone wrong. I go, can you tell me your name and your date of birth? And we're going to ask you to do that too when you're out. Every facility doesn't put a name band on a patient, particularly like a long-term care facility. They're not going to have a name band on, so you got to identify that person, okay? And so you want to think about that. And then listen to me. There have been some hospitals across the country that had their computers hacked. The nurses had to go back and use a traditional MAR, what's called a medication administration record. I'm going to show you a couple of those in lab because I don't want you to panic if something happens. You kind of have to write everything out. It's kind of time consuming. We used to have to assign a person to do that job to take care of the MARs. But you should be ready to know that something like that could happen, especially in our current state of the world that's going on. So what does hypersensitivity refer to? Well, three things. The first one would be an allergy. I think you guys know signs of an allergy: a rash, sneezing, watery eyes, broke out red skin. Angioedema is a severe reaction involving the lips, face, throat, neck, and the GI area where you kind of swell up and they end up needing Benadryl, which is diphenhydramine, and corticosteroids, and possibly epinephrine and oxygen. The term anaphylaxis is life-threatening. A person has anxiety, weakness, itching, hives. Erythema is redness. Angioedema is the swelling up above. Crackles, wheezing, stridor. I hate to do stridor here when I'm doing a voiceover, but it's when your lungs are getting swollen. They make a noise like this. They can't hear. And that could lead to respiratory failure. Prevention and rapid intervention is really important to survival. If a patient does have an allergy, they probably should wear a medic alert bracelet. And if you come in and they're having a reaction, you need to stop the medication. You don't need an order for that. If I'm getting an antibiotic and you walk in and I'm anxious and weak and I'm broke out in hives and you suddenly hear Strider going, you need to stop the antibiotic. This is not rocket science here. Okay, guys? That's always my big go-to thing, and everyone laughs when I say it, but that's an answer in a test question. You have the right. You stop that. That's your job, what you do as a nurse.